An addiction is the most severe form of a substance use disorder, and it's actually the transition where an individual has stopped taking the drug just because they're making the decision and they want to feel good, into a situation where they can no longer stop the drug, even when they want to do so, and at the cost of actually consequences to their health and their well-being. So addiction is defined as that transition from choosing to take the drug from pleasure into the loss of control over that intake with negative consequences to the individual. Addiction is a disease of the brain, but the changes that it produces are long-lasting, and that's why we refer to addiction as a chronic disease of the brain. And the other characteristic is that it's associated with periods where the individuals are able to refrain from taking drugs and then they relapse, and that's why it's actually considered a chronic relapsing disorder. Now, with repeated treatment, what starts to happen is that those relapses, the probability of those relapses decreases, and with time, they basically no longer appear. So the goal of treatment is to bring someone into that stage where they are actually much more stable, nonetheless recognizing that because it is a chronic disease, you always have to be mindful of the possibility that if there are adverse circumstances, that individual always have a risk of relapsing.